And here is your question. All right. So if you have read and understood, considering it surgical pathology station, kindly tell me after reading the STEM, what are the differential diagnoses that you will consider for this patient?
Okay, so here I will go for malignant melanoma
Very good. And
and maybe squamous cell carcinoma
okay.
or lymphoma.
All right. Good. Very good. How would you confirm your diagnosis?
Okay, so to confirm the diagnosis, we have to do a excisional biopsy
Okay.
from the lesion on the leg.
Yes. And
Maybe we can do some imaging, some blood test.
yes.
We have to do chest, abdominal, CT scan, and maybe ultrasound.
Yes.
We can do full blood count, CRP, UNE.
What kind of condition is malignant melanoma?
So malignant melanoma is a malignant tumor of the melanocyte.
Okay. What pathogenesis occurs, or what are the pathogenesis of malignant melanoma?
So it will be a malignant tumor of the melanocyte, which is forming, which will produce melanin.
Yes. And
And
how pathologically, how does it occur? How the process, the disease process takes place? Because if you're suspecting malignant melanoma, so if you will take the biopsy or you'll do the excision, what do you expect to see in histology report?
we have to see the size of the tumor, then type of the tumor, and then marginal status, Breslow thickness,
No,
and
it's in
any positive
histology.
lymph node or not.
Yeah, but these are the broad macroscopic, but microscopically, what would you see? Okay, what else would you offer? You can come back to this question later. What else can you offer as a management to this patient after you've done excision biopsy?
After the excision biopsy, we can send for biopsy. Then we have to see the Breslow thickness. So according to the Breslow thickness, patient might need re-biopsy again. So we have to re-biopsy, and then maybe if the lesion is big enough, then we can do maybe wound closure, either by primary intention or maybe flap skin graft.
Okay.
And then we can go for
can you tell me
chemotherapy,
what are
radiation
the
therapy.
Different types of malignant melanoma that you are aware of?
So there are commonly 4 types: superficial spreading melanoma, then nodular melanoma, acral melanoma, and lentigo-lentigious melanoma.
What kind of melanoma is desmoplastic?
So desmoplastic is atypical melanoma.
It's rare, non-pigmented.
Yes, and is
Occurs
rare.
on sun-exposed areas. Okay, can you
Yes.
describe what is epithelioid melanoma?
So epithelioid melanoma is a melanoma which is arising from the epithelioid cell.
Yes. And
is also one rare melanoma.
all right. For this patient, how would you carry out the examination, clinical examination?
So we have to check the patient. Is there like any other lesion is there in any other site? Then we have to check the lymph nodes, maybe the popliteal lymph nodes, inguinal lymph nodes.
For
And then,
this patient, where would be the primary site of lesion?
so as is on the right leg, we have to check the popliteal lymph node and inguinal lymph node on the right side, right inguinal lymph node.
Yes. Okay. Is there any role of radiation therapy for the treatment of this patient after you have excised the lesion?
Yeah, we can go for radiation therapy.
All right. Right. Can you tell me how would you know the phenotype of the tumor?
By immunohistochemistry.
All right, good. Post-operatively, what advice would you give to the patient? You've excised the lesion, you've done the radiation. What advice would you give to the patient?
So we'll explain the patient if any other lesion, they should come back to us. Then don't go for like ultraviolet or sun exposed area.
Yes.
And then
Post-operatively, this same lady, this same patient comes back to you,
so,
and
okay,
she has
so we'll ask them if
red,
there is any sign of infection, any pus is coming from the wound, or any poor wound healing.
Yes.
They should come to us. And as the patient is osteoarthritis, she might have some steroid. So we have to explain that a steroid might cause a poor wound healing there. And
Yeah, but this same lady comes back to you and she has red wound, swollen, and you take the culture of that wound. Right. Meanwhile, she's waiting for the culture. What would you do? How would you manage the patient? What are the
so we
common
have
organisms that you expect?
So we maybe Staphylococcus aureus. So we have to clean the wound, dress the wound, and then we can start antibiotic like cloxacillin. And then we wait for the culture and sensitivity result. Then we will adjust the antibiotic according to the culture and sensitivity result.
Patient all of a sudden becomes really ill. She has become toxic, and you suspect that toxemia is spreading spreading the infection, and the result comes back and it's necrotizing fasciitis. What would you do now?
Okay, so we have to examine the patient properly. Is there any necrotizing fasciitis? If they are like painful swelling and any gas forming. So if there is a deep infection, so we can go for a deep incision and drainage or debridement.
Okay. Do you know if you've heard of the terminology SIRS?
Yes, we know is a syndrome of inappropriate, is a systemic inflammatory response syndrome.
Yes.
So which is characterized by blood pressure is low, temperature is either more than 38 or less than 36.
Yes.
And pulse more than 90 beats per minute, respiration more than 20 breaths per minute, and maybe WBC more than 11,000 or less than 4,000.
Yes, 12.
And then lactodehydrogenase can be high, blood sugar can be more than 10 millimole per liter.
Yes. How does it affect the lungs?
So in lungs, maybe it can develop ARDS, acute respiratory distress syndrome.
Yes. What is acute respiratory distress syndrome?
So acute respiratory distress syndrome is an acute condition of the lungs where a patient is having
diffuse alveolar damage,
diffuse alveolar damage,
lung capillary endothelial injury.
hypoventilation.
Yes. Leading to surfactant dysfunction and all these dysfunctions. Good, very good. Can you describe the image that you're looking at? What do you see?
This one is a black everted edge lesion.
Yes. How long? How big is it?
It could
2
be
into 4 or 5
2 into
centimeter,
3,
whatever you have to millimeter,
yes,
or
millimeter. Yes.
And it's black and
is irregular.
Irregular. Okay, you said everted, so it's
Everted.
raised. It's dry, crest-like, and
like no ulceration.
all right. Okay, what about this one? Isn't this ulceration, or is it just a crest?
Yeah, maybe just a crest-like lesion.
Crest-like lesion. Okay. What more can you see? Do you see any telangiectasia around? No.
It's not visible very clearly.
Yeah, but that's what you'll get to see and discuss or comment on. Right. There is no sign of inflammation as such. You can't see. Right?
Yes, ma'am.
Yeah. But there are a few other lesions as well.
Yeah, a few
nearby.
others, a small
so you have to
lesion
mention
around
those as well.
Yeah.
Yeah. Smaller lesions are noticed. So as a whole, you have to describe the whole image, the whole picture. Right. Good.
Okay.
Thank you.